Now, Carmel Fitzpatrick didn't like going to dentists and had ignored her teeth for years. She wouldn't smile in any pictures and couldn't eat apples anymore. Carmel's son is getting married later on this year, and her greatest wish was to be able to smile in the family pictures. So she applied to a Seapoint dental makeover competition.
And she's a lucky lady because Carmel won the chance to make over her smile with the help of Seapoint and Dr. Thomas Linehan. This morning we're going to take a look at how Carmel got on at the clinic, and we'll see her new megawatt smile. We're joined by Carmel and of course dentist Thomas Linehan. But first, let's take a look at how she got on at Seapoint.
I'm still very excited about the whole thing. I can't believe it, and I can't believe how quickly the whole thing is going. I've already got a temporary denture. I mean, to me, the thoughts of having teeth removed was a nightmare, would be a nightmare, but they're gone already, the rotten ones, and I'm smiling already. I even bought lipstick for the first time in 20 years, I'd say. So can't wait for the rest of it now. I believe I'm going to have a lot of work done on the bottom this morning, and I never thought I'd say this, but I'm quite looking forward to it. I would find it very difficult to eat certain foods. Like, I wouldn't have eaten an apple in years, and I wouldn't eat steak when I'd be out, because if it wasn't cooked kind of properly, I wouldn't be able to chew it, you know. So a lot of chicken dishes for me, and bananas and stuff like that, you know. But it's going to make a huge difference in every day-to-day life, really, you know. You know, when you're in a situation where you meet somebody new or out for a meal with somebody, I would tend to sit like that, you know, and even if I'm laughing when I'm out, I'd laugh, but I would kind of go like that, because I would imagine that all anyone sees when they look at me are my teeth, and that's really how I felt, that's all they see, they don't see anything else, and it would have a huge effect on you, you know. So this is going to be a whole new lease of life for me. I just will feel more confident smiling, and we have a big event coming up in November. My son is getting married, and I will be in every photograph and I will be smiling in every photograph, and I'm just delighted, and the family are all thrilled for me as well, so it's going to be great.
Took Carmel in, we took a 3D scan of her mouth, and we sat her down with our coordinators and our lab technicians to decide exactly what kind of teeth might suit her and what might look well in her mouth, and then what would be comfortable and work for her for a long, long time. From our 3D scans and 3D images that we take of your mouth, we can design lots of these teeth in just one day. So we did phase 1 a couple of days ago, and I think you've seen the results of that already. Stage 2 today is to deal with some of the underlying healthcare issues and working through to make sure that she's got a bite that works for her to chew her dinner comfortably for her for the rest of her life. Later on today we're going to be seeing the end result. I think we're all a little bit excited to see it.
Oh, there you go.
Look at her now.
We were going to say, no, don't smile until the reveal, but you can't stop yourself.
Can't help herself.
Well, I mean, if you have teeth like these, you've got to smile, haven't you?
Oh, isn't that great?
Okay, now let's be, and it looks amazing, and if this was the end product, you'd be very happy, but this is only the halfway stage. These are only the temps.
I can't believe it, and I can't believe how quickly it's all happened, you know. The top teeth, as you saw, were absolutely atrocious, and of course I would be very nervous thinking about having them out, but they very cleverly duped me into a visit where I was told that some of my lab work was ready earlier than expected. So I went out and went to see Ed, and he said, now we got your temporary denture ready, so if you'd like to hop up there, I'll lob those teeth out for you And I looked at him and thought, is this man insane? He's going to lob my teeth out. And he did. Within minutes, they were gone. Actually,
we think of it like it's nothing, you know. It's we know how easy the process is for people. So, you know, sometimes it's just about going and get it done.
I mean, it's vital that you preserve as much of the tooth as you possibly can. And these are crowns.
Well, in every plan, we always try and protect people's teeth as much as possible and rebuild where possible. If something can't be rebuilt, we use things like dental implants and reconstructive techniques to rebuild something that's comfortable.
Okay, what did you have to do for Carmel?
For Carmel, there were some teeth that we couldn't save. So when something can't be saved, you know, we don't cry about it anymore. We know that we've got the technology and the ability to just put back what nature, you know, meant to have there nowadays, and to give somebody back something that's completely comfortable and works exactly the same as natural teeth nowadays. So we just go and do it.
Look at these shots here. You would literally have taken these down to stumps, effectively, would you?
Well, some of Carmel's teeth we had to do a technique called crowning on them, and crowning is done when a tooth doesn't have enough structure left to be healthy anymore. So we rebuild it, and it can be done so conservatively nowadays and so strongly and so beautifully. It's about judging each tooth on its basis and figuring out exactly what's best for that individual person. In Carmel's case, we used a combination of techniques to rebuild something that was beautiful and comfortable.
Carmel, I think you're really brave, because I think there's loads of people all over the country this morning thinking, I'm in the same situation. You're very honest. You said you're very partial to sweet things, fizzy drinks. You were a smoker for a long time.
Yes, yeah.
You hadn't looked after your teeth after a bad incident when you were 10.
Yes. Yeah.
And I think there's tons of people all over the country in the exact same situation, but aren't necessarily brave enough to have those photographs taken and do something about it.
I know they were a bit embarrassing, but it's very much worth it.
But it's worth it now. She's beaming, literally.
But here's the thing. Now, the other thing is that it is a very natural looking smile.
Yes.
I mean, you know, people get a lot of very expensive dentistry done and they end up with these incredible tombstones, and if they open their mouth, people are blinded, and you need sunglasses to look at them, and you have the Simon Cowell thing, and you kind of go, yeah, that's very expensive. But you know what? Yeah, exactly. You actually look like somebody who's had very good teeth and taken care of them all your life.
Yeah. Thank you very much.
Yeah.
But it's a very natural looking job. I'm just wondering how you do that, because quite often it would seem to me with expensive dentistry, the dentistry takes over the mouth rather than conforming to what actually should be in the mouth in the first place. So how do you do that?
Replicating nature is one of the trickier things to do. I suppose at Seapoint we have an on-site dental laboratory where we have all of the technicians on site who can design these things, looking at somebody's face and knowing what their complexion are and talking to them, you know, finding out what is it that an individual person wants to achieve. Everybody wants.
So, for example,
things.
if Carmel had say a slight overbite all her life, would you correct that in the dental work, or would you actually leave it as was but just make everything, you know, look slightly prettier?
Look good around it.
Well, I suppose it depends on what Carmel would like to achieve. Some people want specific things. Some people want perfect teeth, and other people want to look like they've never been to the dentist. So it's about listening to each individual person's you know, their requirements, what it is that they want to achieve.
So there isn't
and doing
one
that.
ideal, I suppose.
No,
that's the important thing.
It's not about the teeth that I like. It's the
But
teeth
is that not the problem,
likes.
though, with a lot of expensive dentistry these days? Everybody looks like they've got.
It ends up looking a little bit the same,
yeah,
doesn't it?
Exactly. What did you want, Carmel?
Oh, just anything was an improvement on what I had. But this just feels like I've always had these teeth, you know, they just feel like
And did you have any problem with articulating or...
No, at all.
You know,
I'm always well able to talk.
what about eating? Because you said that you hadn't eaten an apple or a hard fruit or something like that for a very long time.
For a long time. Well, I've had a cowboy steak and it was absolutely gorgeous, and I had no problem wolfing it down.
Well, now here's the thing.
Will you smile in the photographs at your son's wedding later on
this year? They will have to
her.
fight to get me out of the photographs.
What's hard to believe is that you're only halfway through, Tom. So what's next?
What's next is finalising the bottom ones, getting the final crowns on, and finalising the dental implant treatment, so that from a functional perspective, from being able to chew food for the rest of her life. I suppose teeth isn't something that we try and achieve just for a couple of months or a couple of years. This is about something that will work for Carmel for the rest of her life.
Mm-hmm.
Now, Carmel, you were lucky enough, obviously, you won the competition through us. I have to ask you, because it's a question people at home are asking. Right, if I didn't win a competition...
How much will it cost me?
And I had to pay for it, what ballpark, roughly, what will we be talking about here?
There are solutions for everybody. Dentistry doesn't need to be expensive. It genuinely doesn't.
But seriously, because people will say, I'd love to do that, but do I need to take out a second mortgage?
No, absolutely not. Dentistry is a process where, if it's worth doing, you can set out a time that it takes to do it. If having a healthy, comfortable mouth is something that you want to achieve, we say, okay, it might take some time with some very extreme cases, but if it's worth doing, you spread it out over a period of time and you have it. If it's the difference between being able to eat your dinner for the rest of your life and not being able to eat dinner.
So just as a matter of interest, I know look, you're not here to sell what you're doing, the work speaks for itself, but if I went to you and had a really bad job, but I couldn't afford to have it all done, is there some form of plan that can be worked out?
Absolutely. You know,
so you kind of do
what's important is achieving something that's healthy and that works for you, of course.
Cool. All right, that's grand. Oh, listen,
well done.
Come and talk to us this evening.
Carmel, and we're only halfway through. God knows what you're going to do. You're going to be like Beyonce by the time you're finished.
only if she wants to be.
That'd be cool, she says.
Can you organise a Beyonce? Look.
She'll have Beyonce's moves on the dance floor as well at the wedding.
All right, listen, thank you very much indeed, and we look forward.
Thank you very much. I can't
Cheers.
say thank you enough.
No.